was going out on a training bicycle ride. I ride bikes a lot, and I was riding through Mill Valley, came through Corte Madera, and I passed out. And I didn't know it, but I had a cardiac arrest. It was what people refer to as a widowmaker, and I was basically dead.
He had actually the thing that we get worried about the most, which is sudden cardiac deaths. He came into Marin General Hospital, and with our team, we worked to figure out what kinds of things that we could do to bring him back and preserve his life.
One was restoring blood flow to his heart muscle by opening up an artery in the cardiac catheterization lab. The other thing was the implantation of a cardiac defibrillator, which was also performed at the hospital in the electrophysiology department.
When I was in the ambulance, my wife called my doctor in the city, and he goes, he's in great hands in Marin General. They've got a great cardiovascular team. You know, they got a great cath lab.
Marin General Hospital has always been on the forefront of cardiovascular innovation. We were the first center to do thrombolytics in the Bay Area. We were the first in the Bay Area to do 24/7 angioplasty for treating heart attacks. As a result, we are in the top 99th percentile of hospitals in the country as far as door-to-balloon time, opening up arteries fast, and having successful outcomes.
We pride ourselves on staying on the cutting edge of technology here. The hospital has been an excellent partner in investing in those technologies. I think that's one of the most exciting things for me about vascular surgery is that it is a dynamic practice. It changes all of the time. I was the first to do an endovascular aneurysm repair at this institution. Now, most of the aneurysms we fix are with endovascular techniques, meaning minimally invasive.
We're actually going to be one of the first hospitals in this area to launch a technology that helps to understand why people have strokes or cryptogenic strokes that we don't understand. We're one of very few hospitals in this area and across the country that are doing a lariat procedure, which is a cutting-edge procedure to help isolate this area of the heart called the left atrial appendage.
When we're together, it's a focused team approach where everyone is invited and really asked to contribute.
You need to be able to connect with people that you trust and people who are experts in their field and who have the best interest of the patient at heart. I mean, it's a very rare combination that you get that. So when those things intersect, it's a great, great place. And then you can talk to your patients and you can say, hey, you should see my colleague, or my colleague's going to come and talk to you. Honestly, that's what you would want for your own family. And for a doctor to say that, I think for a nurse to say that, for a technical staff to say that, that means you're home.
That's what blows you away, is like you're this one individual, but you got this whole team of professionals to get you back up. And when you're in this window, you have to have these capabilities nearby. So it's important not to have to be transported in traffic over a bridge through the city. You know, we've got to have something like this in Marin.
It could be a real potential problem if we don't have community support. Without it, if one service starts to lose its ability to perform what it needs to perform, the other services are affected. And in that case, we would potentially lose those services here at Marin General, and our patients would have to go further away to get care that needs to happen rapidly.
One of the things that's really great about Marin that I experienced is the quality of healthcare. This hospital was full of my heroes, you know, people that you know make an impact, people that have impacted my life.
I love taking care of the patients, getting to know their stories, and knowing that what we do in here, that makes a difference in how they lead their lives.
At the end of the day, the goal is what can we all do to help the patient? And I think it's in the front of all of our minds. The staff, the physicians, the nurses, we're all here to do that.
My passion is to see a successful outcome. I came up from a farming area in Pennsylvania, and you knew everybody in town. Well, Marin is like that. You get to know everybody, and you feel part of the community.
There's a lot of pride in this community about offering the very best we possibly can. The people here are my neighbors. I'm very proud to see that we have reached a point where it's a place where people come to get the very best care possible. I'm here at Marin General Hospital because I love the spirit of innovation and creativity and collaboration.
Because I'm able to perform cutting-edge interventional cardiology, and because Marin is my home.
Because I'm able to do what I love to do in electrophysiology, which is what drives me to do work in the mornings.
Because a group of us decided to make this institution the right place to take care of our patients with the best possible outcomes.
My name is Bob Loback, and Marin General Hospital is my community hospital.